good afternoon. We are here today to solve a major problem, a very big problem, which is an epidemic in India. I'm glad to see the audience. I'm happy with the numbers here today because unfortunately very few people are interested in this very deadly disease, which is so easy to prevent. So I'm going to talk about a major problem with a very easy solution. So I'll quickly go through my presentation with a little bit of data statistics and how together we can actually overcome oral cancer. Prevention is better than cure. So let's see how we can go about curing, or rather preventing or overcoming this deadly disease. And after the presentation, I'll quickly demonstrate my very painless, simple, easy to do dual biopsy test kit which I have invented and recently launched. So with the help of this kit, we can actually detect oral cancer years in advance. You all are dentists, and you all are aware that dentist is the first line of defense. We spend minimum 20 minutes, 15 to 20 minutes in the patient's oral cavity. So why not look for those early signs, those red and white patches which our books teach us. So it's very simple. Just train your eyes to look for those lesions and get a very simple screening test done. And of course, once you get the report, then you have to counsel the patient, break his habit. I'm sure you all are aware regarding the causes of cancer, and most of them have a habit or a sharp tooth, or basically it's a lifestyle disease and it can be easily prevented. So let's quickly run through the slides and then I will demonstrate my kit. How do we? I think I'll stand this side. Is it okay? So here we go. According to World Health Organization, basically, although we have advanced in science and technology, we have all the best of equipments for surgery, radiation, chemotherapy, the numbers of oral cancer, the mortality rate has not yet come down in the last 50 years. So actually the World Health Organization has warned India to do something about it. Among all cancers of the body, oral cancer is the #1 cause of death in India, mainly due to the use of tobacco in various forms. I just met doctor a few minutes ago and she was talking about how people have invented various techniques of using tobacco. Yes, we all know it's not just smokeless tobacco. They use it in toothpaste, they use it in the powder form, they use it in charcoal, they use it in, of course smoking is also one of the causes, but smokeless tobacco or chewing gutka is one of the major causes. So, yes, it's #1 cause of death. Next, please. A few statistics. Unfortunately, we don't have the exact numbers. There's no registry in India which gives us the number, and also unfortunately more than 70% of the oral cancer is in rural India, where there's no awareness and where there's no reach. Unfortunately those people in rural India have no reach to a hospital or a doctor. So most of the patients just die. What we need to do is we need to reach there. I know it's a major task. It's something close to impossible. But yes, 70% of oral cancer lies in rural India. And can you just go back? Yeah. So it says 80% of these patients come to us late. They come to us in stage 3 and stage 4, where it's already spread to other parts of the body. So obviously the treatment gets more difficult. It's always surgery, a combination of chemotherapy, radiation, and not to forget the suffering. Not only the patient but the entire family suffers. And they all come to us late. So can't we see them in stage 1 and stage 2? Why stage 3? when it's already beyond, it's not in our hand to save a life. So yes, we just have about the survival. All these patients live just for 3 to 5 years, maximum 5 years, with the best of treatment possible. I think 5 years is also too much. And yes, I've already spoken about this, that the high mortality rate. Why is it so in India that the last 50 years the mortality rate has not come down? Simply due to lack of awareness and late detection. We have nothing to screen the patients early. Okay, so here we have how we can prevent cancer is by primary and secondary invention. Primary is through awareness, and of course secondary is the early diagnosis. I just mentioned we don't have anything yet, but yes, we are going to have something very soon. These are the various very generous donors of oral cancer. And talking about, there was a picture on hookah, that's a myth. We can have an entire session about hookah and how hazardous it is, and people have been talking about it not being tobacco and getting filtered through water, and it's not really addictive. It's all a myth. So of course that we can have a separate session altogether. And a very important point is who should consider screening. Anybody above the age of 18, or rather 16, because there was a 16-year-old boy at Tata Hospital. And when I went on a tour to Gujarat, I realized that children as young as 8 years, they start chewing tobacco. Especially the city of Ahmedabad and city of Rajkot. Every few feet there is a pan stall with the colorful gutka hanging. And so if the child starts as early as 8 years old, definitely in the next 4 to 5 years he's bound to have cancer. But generally about the age of 16 or 18, these are the patients who can get themselves screened. Any kinds of habit, tobacco, smoking, alcohol. Alcohol and smoking together is really at a high risk. The patients are at a high risk. Of course, any family history of any cancer, not just oral cancer. Because cancer happens when the genetics places an order. I'm sure you all know that we all are exposed to some kind of, at least 8 to 10 times in life when our immunity goes down, and when the normal multiplication of the cell or the normal process goes beyond control, and the cells just keep multiplying. That is what is cancer, that is what is malignancy. But the ability of the body to fight such conditions, we all overcome that. But basically, it's the genes that are demanding, that place a command for the cell multiplication. So yes, genetics is a very big cause. So any kind of family history, those patients are at high risk. And very important, please go back, there's a, which is not mentioned here, there's a very important risk factor, which is a virus, HPV 16. Okay, it's the same virus which causes cervical cancer. I can see a lot of head nodding, so I'm really happy that all my fellow friends here are aware already. So it's nothing new. But yes, with the coming years and with the advances in technology and with the research, I've already been doing 2 years of research on HPV 16, and possibly we can have a vaccine, just as we have for cervical cancer. We can have a vaccine for oral cancer. But the numbers are not really extremely high. It's just about 20-25% of the oral cancer patients that have the virus. So you can't say, because there are other causes, like tobacco is a major cause. Sharp tooth again is a very, very, very major cause. It's almost equal to the use of tobacco. So we as dentists, it's our duty to look for sharp teeth, people who have the clenching habit, those are bruxers. We have to round off the sharp edges, give them a night guard. It's our duty to inform the patient. It's our duty to prevent this deadly disease. Yes, now you can go. You all can see that, these are the, you can go back. These are all doctors here.
Okay.
So I'm sure you can see this.